Hello, my name's Dr. Felicity Park and I'm an obstetrician at Hunter Hospital. We're recording this in response to a number of questions that are coming from our women, both on the website and in person, who are pregnant in relation to COVID-19. The first question is COVID-19 dangerous while you're pregnant? We have little information about COVID-19 in relation to pregnancy, but it would appear that women are no more at risk of contracting the virus or becoming very sick with the virus because they're pregnant. Women who are pregnant but also have other medical problems are at increased risk from COVID-19, and they're a group of women that we would increase the amount of time we would spend reviewing and looking at them. Women are asking, is it dangerous for my baby if I contract COVID-19 while pregnant? The virus does not appear to be transmitted from mum to baby during the pregnancy. There is no evidence that COVID-19 increases the risk of birth defects. The biggest risk appears to be if you get very sick and go into labour early. And in labour, if you have COVID-19 active at the time, the reduced ability of your body to carry oxygen may increase the chance of your baby needing an urgent delivery. So for that reason, for women who have COVID-19 at the time of their birth, we are recommending delivery in hospital. What about if you get COVID-19 soon after birth? It is possible to transmit COVID-19 from mum to baby in the period of time after birth, much in the same way as it is possible to transmit the virus to other people. We have recommendations in place to try and limit the chance of transmission of COVID-19 from you to your baby. These are individualised and varied depending on your individual circumstances. And if you go into birth with active COVID-19, then one of our senior baby doctors or neonatologists will be available to help you make decisions on how you best limit the chance of transmitting COVID-19 to your baby. Women have asked about breastfeeding with COVID-19. There are only a small number of women with the virus whose breast milk has been tested, and there has not been any virus identified within their breast milk. At this stage, we believe breast milk is safe to give your baby if you're infected with COVID-19. It appears that another option may be to offer the baby expressed breast milk if you are unwell by another member of the family who is well. Women are also concerned about what happens if someone else within the household develops symptoms of COVID-19 while they and their baby have come home. The principles apply in much the same way as we limit transmission of COVID-19 within the community. We would recommend that a person with symptoms remains away from the baby if possible, and if they do need to be close to the baby, that they wash their hands, that they wear a mask, and that they avoid touching the baby's face. We also recommend that if someone in your household is at risk of COVID-19, that you are very careful with your hand hygiene before touching the baby. Right back at the beginning, pregnant women are asking how they avoid getting COVID-19, and it's in exactly the same way that you're hearing the messages from the government and social media. Wash your hands regularly, especially when you have been outside of the house. Practice social distancing, which means limiting your trips outside the house to essential trips only, and if you cough or sneeze, to do so into your elbow rather than into the palm of your hand. Some women have expressed concern or fear about attending antenatal visits or the hospital during their pregnancy. Pregnancy is a time when you do have lots of appointments with your midwife, your doctor, and you require some hospital admissions. We are working very hard to look at ways where we minimise the amount of one-to-one contact while maintaining all of the care you require in your pregnancy, which are important for both baby and you. We're using new ways to look at care with increased risk of outreach midwifery clinics. We're looking at telehealth. We're looking at group antenatal education sessions being performed on Skype. But please be assured that if you develop a complication in your pregnancy, that you must come to the hospital for review. If you have COVID-19 during a regular scheduled antenatal visit, an individual risk assessment will be made as to the safest time and place to provide that ongoing care. Thank you very much, and our staff are going to try to continue to answer your questions.